Hello, ladies and gentlemen. Um, I want us to just look briefly on this topic, infertility. So, this is a topic that affects so many people in society, and I think it's a very important topic. It's something we should be talking about. Of course, there are so many videos out there. There's so many literature, for people to actually, know, get so much insight into this topic. Um, so let's start. What is infertility? So by definition, before you can say a person is suffering from infertility or a couple are suffering, with infertility or experiencing infertility, they should have had up to 12 months, of unprotected intercourse, and of course, unsuccessful attempts at conceiving after a year of unprotected intercourse. Some definitions will go further to talk about adequate, sexual intercourse. And then, when you're asking yourself, what does adequate sexual intercourse, actually entail? Then you'll be talking about, sexual intercourse happening at least twice a week, 2 to 3 times, some say 2 to 4 times a week, but at least twice a week, unprotected for up to 12 months, up to a year. And if this couple have failed to conceive, then you can then say, oh yeah, they are experiencing infertility, and then obviously they need some help or some intervention to help them, in terms of conceiving. Below that definition, you can see something else. If the woman is over 35 years of age, usually if a woman is over 35 years of age, her chances of conceiving is actually lower than someone who is less than 35 years of age. And it just makes sense, isn't it? Because a woman is born with all her eggs and she keeps ovulating, and each time you ovulate, you lose an egg. So the older you get, the less eggs, egg reservoir you have, in your ovaries. So it only makes sense that the older a lady gets, the less, oval eggs she will have in her ovaries. So if a woman is over 35 years of age and she and her husband, she and her partner have tried actively, having regular intercourse at least twice a week, and that intercourse has to be unprotected, and they've gone for up to 6 months without being able to achieve successful conception, then that classifies as infertility, and obviously they would need some help. In terms of the etiology or what causes infertility, this pie chart shows that 30% out of 100%, if you say everyone who has infertility, makes up 100%, 30%, just below a third of those people, or a third of the causes are female, related to a female, the female axis, or let's say female causes of infertility. 30%, are male causes of infertility. And then together, male and female combined, are responsible for 10% of all cases of infertility. And in 25% of cases, investigations will be done and nothing will be found. That's where you see a couple would have, been unable to conceive. They've done all the investigations. The doctors are like, oh yeah, we can't really find anything, to explain why you haven't been able to conceive. The man's, seminal fluid and hormones are all normal. The woman's hormones, genital tracts are all fine, but they're still not able to conceive. Okay, so that unexplained etiology or cause, contributes to 25, which is 1/4, and that's a lot. So imagine that, think about that a quarter of everyone experiencing infertility would actually not know why they're going through that. And that's really devastating, isn't it? Yeah. And then other causes, 5% all the time, other things. This image shows the male reproductive tracts. So there we can see the testicles, which are responsible for producing, both the semen and the sperm cells, then you've got the epididymis, where the sperm cells, are stored for complete maturation. And then you've got your duct, your ductus deferens or your vas deferens, which is just a conduit or a channel through which sperm cells, in semen gets ejaculated. And then when you ejaculate, it goes all the way through this. This is the ejaculatory duct. It goes through this ejaculatory duct into your urethra, and that semen comes out through here, okay, through the tip of the penis. And then you have the seminal vesicle that also contributes, fluid to the semen. Prostate also contributes to the semen, and the testis, the epididymis contributes to the semen. So if you have any problem with your testicle, like a testicular cancer, or people who are born, with atrophic testes, which is essentially a non-functional testicle, or someone who has, trauma, testicular torsion, and then the testis gets dead, or, it dies, or it's removed, people who have anything, infection, epididymocarditis, all those things, anything that attacks or destroys the testicle, people who have had pelvic surgeries that have damaged this vas deferens, or other parts of this tract. Any of these can lead to infertility in men. Yeah, I think my slides are mixed up. Okay, let's progress. So causes of female infertility. In this pie chart, we can see causes of female infertility. You can see that a quarter are ovulatory problems. And when we say ovulatory, we mean there's a problem with the release of eggs. So we've got the ovaries. This is a picture that shows the female genital tract. So we've got, this is the vagina, that's the cervix, that's the uterus, okay? Those are oviducts or fallopian tubes, and those are the fimbria of the fallopian tubes, okay? That look like mop heads, and those are ovaries. So we've got the ovaries, or the female, the female gland that releases the eggs, okay? Houses the eggs and releases your eggs when you ovulate. So if you've got problems with your ovaries in terms of you're not ovulating, the woman is having what we call anovulatory cycles, then she would have problems with conception. And there are different things that could cause these, which we'll actually get to see, things like polycystic ovary syndrome, or some hormonal problems, So ovulatory disorders, you can see when it comes to women, accounts for the most. A quarter of women who are suffering, who have infertility, will actually be due to ovulatory problems. Endometriosis contributes, 15%, which is also a large number. What endometriosis simply means is that if we look at these female reproductive tracts, this uterus is lined by what we call endometrial tissue. If that endometrial tissue is found elsewhere, maybe sometimes even found within the muzzle of the uterus, which we call adenomyosis, or it could be found somewhere else. Sometimes we have endometrial tissue in the fallopian tube or around the fallopian tube, causing blockage and all of that. And you can have endometrial tissue right at the cervix, blocking the opening of the cervix. So if you have this endometrial tissue where it's not meant to be, that's what we call endometriosis. And usually it causes pain, Usually the woman has monthly pain when she has her periods. Pelvic adhesions, are also quite common in terms of female causes of infertility. So if you have adhesions maybe from previous pelvic inflammatory disease, which is like essentially STIs and pelvic infections, we've had previous surgeries, where you've had adhesions. Those adhesions could actually cause constriction or blockage of your fallopian tubes. And then the sperm cells cannot, meet with the released or ovulated eggs, and you can't have fertilization. tubal blockage, from adhesions, from previous sexually transmitted, infections or pelvic inflammatory diseases. So these are things, hyperprolactinemia, which is essentially excess prolactin production usually from your pituitary gland. Someone could have a pituitary tumor, or maybe medication induced. Someone who is on antipsychotic medications could have hyperprolactinemia, and that could actually be causing, infertility. And in 10% of cases of female causes of infertility, no cause is identified. And I think that's usually the case where people feel very frustrated when they've done, they're ovulating well. Doctor tells them they're ovulating well. They haven't got endometriosis. They haven't got pelvic adhesions. They haven't got tubal blockage, which means their tubes are patent. They're ovulating well. Their hormonal, balance is okay, right? And they're still not getting pregnant, and their husbands are fine. Yeah, so if you have a problem with your ovaries, if you've got blockage of your fallopian tubes, if you've got even blockage of this cavity within your endometrium, which we call Asherman syndrome, adhesions within here. If someone has had a previous dilatation and curettage, or if someone has had a previous, endometritis, which is essentially infection of the womb, or someone has had maybe a previous sexually transmitted infection, and you now have adhesions blocking this place, which we call Asherman syndrome. That's also something that could cause infertility. Of course, fibroids can also cause infertility when you have fibroids, occluding or blocking, this cavity. If you have polyps, cervical polyps blocking here, and you have sperm cells not being able to go through, obviously. And if you have problems with your vagina, if you have, the vagina is closed, what we call colpocephaly, either surgically or a form of sexual abuse, or child abuse, someone stitching up your vagina, all those kind of forms of child abuse can also be causes of infertility. Well, that wouldn't classify as infertility because they wouldn't then be able to have, sexual intercourse for 12 months. So that wouldn't actually classify. So back to male causes of infertility. I knew there was a problem with the order of my slides. In 34% of cases of male infertility, 34, that's a lot. You wouldn't know why that infertility is going on. Commonly identified causes are varicocele. That should be an A. So varicocele essentially just means, having varicose veins in and around your testicle, right? Actually around your testicle. And what it means is that you have impaired venous drainage, you have excessive heat around your testicle, and excessive heat is not good for sperm cells. So sperm cells either begin to die or they become sluggish, and you just have, reduced fertility. Hypogonadism. Hypogonadism means your testicle is not functioning adequately, right? And that could be from either the testis having problems itself, or from maybe your pituitary gland, your hypothalamus not releasing enough, sex hormones, not to stimulate your testicle to produce enough hormones to drive production of sperm cells. People with systemic diseases like hypertension, diabetes, some rheumatological conditions that could affect your overall health. Urogenital infections, sexually transmitted infections, all of these can damage your testicle, cause, epididymoitis, which is infective inflammation of your testicle, and undescended testes, can see undescended testes contribute 8%. So if someone is born, you give birth to a male child, and the testicles, you feel the scrotum, and you can't feel the testicles, you need to report to your doctor. Diagnostic approach to infertility in a woman. Well, you want to know if she's having normal menses. Normal menses will give you a clue, tell you, likely she's ovulating, isn't it? She's not having, she's not having periods, or she's having irregular periods. Let's take my face out of the way. She's having irregular periods, then you could be thinking that she's probably having anovulatory cycles. Okay, so I wouldn't really go into all of these. This is just a a flow chart that helps in deciding what needs to be done. So you want to check, obviously from here, you want to check the hormones, the follicle stimulating hormone, the luteinizing hormone. You want to check her prolactin level. These are basic tests that you want to do. You're thinking of things like ovarian failure, polycystic ovary syndrome. So based on the hormonal profile, and of course, based on the symptoms she's having, you will then be able to say, maybe she's having polycystic ovaries, maybe she's having ovarian failure. These are things you would be considering. Same thing for a man. Obviously the doctor will want to feel the testicles, want to examine your abdomen, depending on the age, might want to examine your prostate, want to check your hormonal levels. Of course, want to do your seminal fluid analysis, very important. You want to see, how much are there sperm cells in your semen, first of all? And if there are sperm cells, are these sperm cells healthy? What's the number of normal sperm cells? What's the number of sperm cells that are motile, that are able to swim actively? Because only sperm cells that can swim, that are alive, number one, and then can swim very well, that can actually swim into the fallopian tube and fertilize the eggs. So you also want to check the testosterone level, and some gonadotropins like follicle stimulating and luteinizing hormone. All of these put together will give a very strong clue as to what is responsible for this infertility. And whether a cause has been found, or if a cause has been found, obviously, you want to treat the cause, right? If it's a problem with hormonal imbalance, hormonal deficiencies, you will probably consider hormonal therapies. If it's something like polycystic ovary, you might want to consider some medications that will enhance ovulation, medications like, I think, letrozole, clomiphene, things that can increase the woman's chances of ovulating. If someone has a sexually transmitted infection, you want to treat that, right? Like there's active chlamydia, active gonorrhea, you want to treat that. You might want to try some supplements, that can enhance fertility, okay? And if all of that has failed, then you're thinking of surgery. Or you can also try surgery, for things like endometriosis, varicocele in men, and uterine fibroids. You might want to remove the fibroids, either medically, to shrink them, or surgically, or whatever. And then usually, as a last resort, if you've not been able to sort the problem of infertility using medications or surgery, then you begin to think of alternative ways of helping the couple. Things like IVF, in vitro fertilization, which you can see in this picture. In vitro simply means in the laboratory, so you can see this is like a petri dish. It is a sperm cell, so you're trying to bring a sperm cell and an egg, into contact outside normal human environment, and create that fertilization, and then implants the zygotes or embryos, the embryos back into the woman's body for it to grow. You also have intrauterine insemination, which is different from IVF. So in that situation, you just take the sperm cells or the semen, with a syringe, and inject it into the woman's, genital tract. And then the sperm cells, which should be healthy, will then swim on their own, and fertilize the eggs. Okay, yeah. This image just shows us. Let's go back. So this image is still talking about what IVF is. So you try to do ovarian hyperstimulation, ovarian stimulation to release the eggs, and then you harvest the eggs. So transvaginal oocyte retrieval. So oocytes, you retrieve the oocytes, okay? Yeah, then you fertilize the egg in a petri dish or in any other in vitro mechanism, and then you implant. So transvaginal oocyte retrieval, so embryo transfer. So you now take your embryos and implant them, transfer them back into the woman's reproductive tract, and then the embryos on their own will then implant naturally. Okay, they then implant in the fallopian tube, and then of course the baby grows and the child is born. So infertility is something that a lot of couples, both married and unmarried people who are hoping to have a child, suffer with. And it's usually good when we're able to help people who are experiencing these conditions. Okay. So I hope this video is very helpful. If you know anyone who is, likely to benefit from this video, kindly share it with them. If you've subscribed to my channel before, thank you very much. If you haven't, please and please and please subscribe. Okay. Where my channel will keep growing. We'll keep getting more and more motivated to create more educational, contents. Thank you very much for your engagements. See you. Bye.